This is WPSL Port St. Lucie, the talk of the Treasure Coast.
From the beginning of time, humans have tried to heal themselves with ritual and prayer, and with whatever nature provided. Through thousands of years of trial and error, formal systems of healthcare developed, systems based on foods, herbs, and other natural remedies. These systems live side by side with what we call Western medicine. Western medicine has been an enormous benefit in helping to conquer devastating infections and perfecting surgical procedures. But there is more to medicine than doctors and hospitals, and that's exactly what we'll explore this week on A Better Way to Health. Hello, I'm Stuart Shipe, a registered pharmacist, acupuncture physician, and Chinese herbalist. I'm your host this week. We make no effort to recommend or to judge, only offer that you explore a theory that good medicine comes in many forms. So let's get started. Phone lines are open for you this morning for questions, comments, or experiences about your health on WPSL at 340-1590. That's 340-1590. Let's hear from you.
All right, folks, time to get the show going. Do you really believe, if you've been listening to me for a while, you probably already have this answer ingrained in your mouth, in your head, but if you listen to me for the very first time, do you really believe that medicine has multiple facets and there's many, many ways to get to the root of the problem? If you believe that, you're in the right show, because this medicine that we have in America right now is undergoing a lot of changes, wonderful changes, I think. As we get more research, as we integrate more and more, I think we're going to see better and better stuff coming out of medical interventions. I'm Dr. Stuart Shipe. You can get a hold of me on many different platforms. One is facebook.com/Dr. Shipe, Dr. just like Kathy has done. Thank you, Kathy, for watching the show today on Facebook. You can also get to us on the web at traditionalchinesehealing.com. Or if you want to email me a message, it would be info@traditionalchinesehealing.com. You can also call my office at 772-398-4550, and my staff can get a message to me as well. But since we got Greg hanging in the studio this morning and keeping him busy, 340-1590 is the way to get a hold of me live right now. And you can answer your question and get as good of an answer as I can muster within a couple of seconds back to you. If I can't find one, I'll certainly find it out for you and get back to you if you want to leave a phone number.
Now that you are Zooming in,
I'm a Zoom guy now.
Yeah, you'll also, I think by tomorrow, be on WPSL TV on our website. So yeah, very cool.
Very good. A lot of ways. Hopefully this platform, folks, will give us a little bit more stability. And as we advance to get the show, the best of the health out to you today. So many things that I always bring to the table. I was asked this week, I thought I'd talk about this because I didn't even know about it. And I figured you might not know about it either, unless you're in active oncology care, receiving care for cancer. It's something called repurposing of drugs. Have you ever heard of that before, Greg? Repurposing drugs.
Yeah. NBC use that terminology for television shows. I've never heard that for drugs, though.
Yeah, I didn't either. I was actually asked by the university this past week if I'd give a lecture on it. And I was like, I'll be honest with you, I've never even heard of it. But I can bone up on it. I can study up and find out what I can find out. So I did some initial research, and I actually had turned this one out of 19 years working with the university providing lectures. I finally turned one down because I just didn't think it was in what I was truly interested in. But I want to throw it out there because so many people that are battling cancer may have not met a physician that is interested in repurposing drugs. So what is this theory? And then I want to talk a little bit about that in the show today. And I also want to talk about my specialty, which is really integrating our conventional modern oncological treatments and using the traditional premise and philosophies, the framework, integrating that into a framework of traditional Chinese medicine. And oh my gosh, what great results we get when you start doing that, is combining these medicines, the strength of both of the medicines, in treating the individual. Have pancreatic cancer patient that's currently being seen in the practice right now. I've had breast, cervical, ovarian cancer, so many problems with cancer, and we're trying to always find the cure. So this is what some of the docs are doing. Drugs have been always created for a specific medical condition like diabetes or hypertension or acne, even like in drugs created for deworming of pets, right, or of humans. So now they're being repurposed. These same drugs that were used for diabetes and high blood pressure and worming, they're being repurposed, which means they're being used for something different now. What is that different? Cancer. Isn't this odd? They're being used in oncology to help stop cancers, either the feeding of the cancer to prevent it from feeding, disrupt its growth or disrupt what we call division, cellular division, restrict its metastases, which means it's a creeping crud, and stop that so it can't go into other organ systems, and actually increasing survival times of those affected with cancer. So I'm going to talk a little bit about the medications. I'm not going to go into great depth and give you a pharmacology lecture that I probably would do for a professional audience, but we have what we used to call this when I was practicing pharmacy actively. This was back in the 70s, 80s, even into the 90s. Well, I should say in the 80s. I'm not going to age myself that much, but certainly in the 80s and 90s, we used to call it off-label use. And if you've had a migraine headache, thank you, Cheryl, for watching on Facebook too. I've got you here. If you ever had a headache before, of course, you've had injections maybe that you would institute if the migraine headache came on. But you might have had a doctor one time back in the early 90s, I think it was, if I can remember right, that said, hey, why don't we use this drug called amitriptyline or Elavil for your headache? And I was like, at that time, I even questioned, I was like, Elavil, that's the indication for that drug is really as an antidepressant. It's a member of the family of these, I think it was tricyclic antidepressants at that time. And it has some kind of nasty side effects. One of them is drowsiness and a little bit of dizziness and other side effects, if you're using it long term. So what that doctor was doing was using a drug for an unlabeled use, which means the FDA didn't put their seal of permission that drug should be used for anything other than, say, depressive episodes. So what ends up happening is that physician is kind of getting themselves out on a limb. And if something were to occur with that patient, side effect, bad reaction, we're a litigical society. There's no doubt about that. Everybody wants to sue everybody and their brother. That doctor would be standing out alone on his own 2 feet because all of his peers are going to say, oh, no, Elavil doesn't have an indication for headache. So there's a lot of dividedness and division within the medical community about do we have, quote, the permission from the FDA to utilize drugs for something that they weren't originally purposed for. And that's the big question now. So now let's be clear, drugs, they already exist in nature, right? And on the good side of it is many of these medications have been time tested, which means we've used these drugs for 30 years, 40 years, even more sometimes. And we pretty much know its potential side effect profile. It's been used in millions of individuals. So that's what we're kind of waiting for right now with the COVID virus, right? With the vaccine is we haven't seen huge population studies of individuals that have been given the vaccination. So we really don't know yet what the fallout as far as adverse reaction, side effects, or the comorbidity, what the vaccine might actually induce in the individual. But we have a pretty good idea with these old medications, how doctors know exactly what they do, how they work, and so forth. And by the way, a lot of these drugs that I'm going to talk about are these repurposed drugs are now off patent. So you would think that, wow, if these medications have found a way to help us fight cancer, that the pharmaceutical companies would really be behind it, right? And really helping support this momentum, this drive. No. Why? Because the pharmaceutical big pharma is not making money off these medications anymore because they're off patent. So every little generic house, generic manufacturing facility that is actually making these drugs today, the pharmaceutical company is not reaping any benefit from that.
So whatever happened with don't fool around with Mother Nature?
Yeah, this is interesting because albeit that it's a use of another drug to try and fight cancer, I want to give you one perspective. The reason I didn't want to give a lecture is because I don't feel like I need to be lecturing on medications as a natural physician, and certainly as a Chinese acupuncturist. I really don't feel that it would help me in my journey or in my treatment strategy for patients. This is best left in the realms of pure biomedicine and research, but I did want to bring this in to being because it has some tangible benefits that we can muster. Thank you, Tracy, for coming into Facebook as well. And what is that benefit? We're starting to see that biomedicine, or modern medicine, is taking a look at the body more holistically, seeing that it's not just about one thing that causes cancer. So it's not just one thing or one compound that's going to fight against a cancer and look for a cure. It's looking at all the little pieces of why cancer exists. For instance, when a cancer cell goes renegade, and meaning that it comes away from the pack, whether some mutation occurred in the genetic replication, how a cell is replicated, takes a blueprint and the body's able to exactly replicate or duplicate that cell. It's called a replication. Sometimes I think it's 1 out of a million, or it might be even more than that. 1 out of a million replications has a hiccup naturally in every human body. And the body, usually the immune system, is pretty well set up to check, like a good QC, quality control. The immune system is really set up to detect those little hiccups and destroy that cell very, very rapidly. But if for some reason the immune system is down, it's incompetent, it's taxed like it is right now in our society with the virus, the immune system has another job, a bigger battle to wage, so to speak, and it might leave that unchecked, either due to being naive, being too weak, or naive that cell is kind of goes by unpassed, or the fact is the immune system's just not competent enough to handle it. So whatever the reason is, that cell gets passed, and now that cell has a new blueprint, and that blueprint actually did away with cell growth untamed, so to speak. And that cell will start rapidly replicating, because it's kind of like taking the brakes off of a car. You just have an accelerator and no brakes. Normal healthy cells have an accelerator and a braking system. But when they go renegade, they strip out all the braking system. No parking brake, no brakes at all. It's just full speed forward. This is a cancer. And so there are medications, these repurposed medications, that can actually stop that cancer from being fed, because as that cell goes renegade, not only do they lose the brakes, but they lose the ability, the cell loses the ability to eat protein and eat fat, or I should say metabolize would be the proper word, to metabolize fats or metabolize proteins. It only lives off sugar. It only lives off carbohydrate. So if we repurposed a drug, let's take, for instance, there's a drug called metformin, which is well known if you have diabetes, type 2 diabetes, probably have heard of this drug before. And what it does, it works in the liver, works at the cells to help the cells respond better to insulin, to lower the blood sugar. It actually works in the liver to help in how the liver processes glycogen, which is stored sugar, or sugar in general. So if we were to say, if we wanted to stop the cancer from feeding, it would be a good idea to restrict carbohydrates. I totally agree with that. In fact, Max Gerson, a renowned physician, an MD back in, I think it was the 40s and the 50s, he was renowned for curing cancer with only nutrition. But one of his main premise and his instructions to the patient were no carbohydrates, an extremely low glycemic diet. And I'm talking not even fruit, no fructose, no glucose, no galactose, no sucrose. All of those different types of fruits were restricted, and probably less than about 30 grams a day, which is, if you ever heard of a ketogenic diet, would probably be along the same lines, is letting the body learn how to eat fat and process fat more than just processing carbohydrate. And in that way, you starve the cancer literally, because it can't get food. It can't metabolize protein or fat. So the metformin here, as a repurposed drug used for diabetes, is now being used to restrict the body's utilization of carbohydrate, or I should say, better improve the body's utilization of blood sugar, so that we don't have excess blood sugar hanging around that the cancer can eat. Because let me ask you a question, folks. Who do you think is stronger? Do you think you're stronger, or the cancer is stronger right now if you have cancer in your body? Obviously, you're going to say the cancer is stronger than the immune system. The cancer is stronger than the body because it's growing unregulated and the body can't control it. I totally agree. So who do you think is going to get fed first? The cancer cell or your body's healthy cells? I guarantee you it's, again, the cancer cell. We have a lot of problems with oncological treatments, or oncology, especially with chemotherapy, radiation. Patients' appetite drops to zil. And they say to me, Dr. Shipe, can you help me fight the cancer? And I was like, no, the only very first thing I'm going to help you with is restore strength to what the Chinese would call your earth organ, the spleen and stomach. Because if you lose your appetite and you're no longer eating food, it's not much time before the human body can't survive healthy cells without getting nutrition. And that patient will muscle waste, extremely common in oncology. That patient's main pattern of fear, for me at least, is malnutrition. You have to maintain your appetite. You have to maintain nutrients, and you have to protect that digestive system, because the digestive system in Chinese medicine is the immune system. They're one and the same. So if we can improve the digestive system, we're going to improve the immune system's ability to fight the cancer. So using off-label drugs to beat cancer, there's been some pretty good evidence, mostly coming from the UK, from the United Kingdom. And those guys, the Europeans don't have as many constraints like we do with the FDA. There's a lot of treatments, and you know this already, folks, in listening, just to the media. If you know somebody that has like cancer, for instance, they're probably going to tell you, well, I went to Europe for treatment, or I went to the Caribbean, or I went to South America, or I went to Mexico for the treatments. Many fringe treatments for cancer are not being done in the United States. It's out of the scope of Western physicians. The FDA doesn't put their blessing on them, but you hear all the time that these individuals come back into the States cured from cancer by whatever therapy that they actually had. Well, that was in April 2015. A Professor Ben Williams paid a visit to London. It's claimed he beat his brain cancer, the worst of all, a glioblastoma, which are nasty, nasty brain cancers, back in 1995, by adding a simple sleeping drug called melatonin. And it's really not a drug. I wouldn't say it's a drug. Melatonin is a natural hormone we all produce. And it's important to kind of recognize sleep cycles, because as we get later in the evening and the darkness starts falling, our eyes pick that up, start signaling to our brain, night is coming. As biological humanoids, we usually sleep at night to rest and detoxify and recuperate our systems, at least rest our systems for a while. But it's actually the fall in the melatonin levels that actually puts us to sleep, and the rise in the melatonin and cortisol levels in the morning that actually wake us up. So this guy started taking melatonin, took an antacid called cimetidine. That's an old one. Tagamet, man, that's been out. I was a student, in a pharmacy working as an intern back in the 80s. And that was like 83, 82, that Tagamet came out. It was like a miracle drug for ulcers. But here, why are we using Tagamet? That doesn't make a lot of sense, right? It's because cancer, in order to spread, a cancerous cell uses a compound, a chemical in our body called histamine. And histamine causes the cancer to spread. It causes inflammation in the body. Cancers love inflammation, because inflammation causes stagnation. Inflammation in Chinese medicine causes qi stagnation, or dampness. And if you have things that are stagnating the flow of circulation of energy or blood in the body, cancers love that. They love that stagnant environment. So we don't want a lot of histamine. We don't want a lot of inflammation. So how do we get rid of the inflammation? In biomedicine, we use antihistamines, and a really powerful antihistamine in the stomach or in the gastrointestinal system is Tagamet, ranitidine, which I think they just actually took off the market, Zantac. You hear about all the legal stuff going on right now with Zantac causing cancer, right? So I don't know. Well, here's the dichotomy. Upon bringing that up, I just had a brain awakening. So you're saying, but Dr. Shipe, these histamine antagonists, or these drugs that block histamine that are helpful for cancer, you just told me that Tagamet has a potential for causing cancer. Yeah, I know. That's a problem, right? I can't give you an explanation for that one. But all I can say is that that's the world of repurposing medications. There's huge divisions right now in the oncologists. Like there's an oncologist group that says, hey man, we're starting to see some really good clinical studies and some research that's showing us that addition of these drugs, these old drugs that we've used forever in now treating cancer is going to be a benefit to this individual, and is going to have them have a longer lifespan. It's going to reduce some of the symptomology and certainly reduce the growth of the cancer. So even like verapamil, how many of you are on verapamil for hypertension or high blood pressure, right? The blood pressure drug and an acne medication. I was really experienced in this drug because this came out when I was coming into pharmacy school, called Accutane, used for recalcitrant cystic acne in teenagers. Man, it is a miracle drug. But after a couple of years, they looked at its effect on the liver, and especially on teratogenic effects, which means young females that were taking this drug that got pregnant actually started having birth defects in the fetus. So they like, the brakes are on that. And obviously, if I don't even know right now the prescribing data on this drug, but if you were a young menstruating female right now, you would actually have to get liver function test and a birth control test before the physician would be able to prescribe it to you. That's how cautious we are with some of these medications. But for the most part, a lot of these meds have marginal or not too aggressive side effect profiles or adverse reactions. So there was, after 20 years of a diagnosis, there's a film, evidently a film made by the story of this Ben Williams by Dominic Hall. It's called Surviving Terminal Cancer. The UK launched that by the Brain Tumor Clarity Association, whatever. So there's been some pretty good testimonials by individuals that are being used to promote the use of these repurposed drugs. Things like non-steroidal anti-inflammatory drugs. Now, you heard of ibuprofen, naproxen, Clinaril. There was an old drug by the name of indomethacin, or at that point, that was an initial miracle as well at reducing inflammation, mostly for arthritis. People took indomethacin because it really did work well. And even when I was in pharmacy school, it was still being dispensed and ordered fairly routinely. But again, in about 1990, somewhere in there, I can remember as a pharmacist, all of a sudden, what we started seeing was it was a good drug in the fact that you only had to take it one time a day instead of taking it 2-3 times a day. Why did they pull it off? Why aren't we using it now? Because it actually caused stomach ulcers. It had a pretty high prevalence at a pretty high rate. And so they said, no, we've got better anti-inflammatories now that don't cause ulcers that are on the market. And so when we find better drugs that do the same thing, that have less side effects or less adverse reactions, of course, we're going to use those and do away with the old ones. But they found that indomethacin actually reduced or increased the survival rate in serious ovarian cancers. So now you have to make the decision. Is it worth the risk of the ulcer bringing the drug back over the gains that we have from helping this patient survive ovarian cancer? So it really does become a risk versus benefit. How about chloroquine? You know about hydroxychloroquine. Wow, that was in the news for many months there during the Trump presidency about wanting to bring this drug in to cure. But chloroquine is an old anti-malarial drug, and it can increase the lifespan of drugs used to treat BRAF mutations in brain tumors, it was found. So chloroquine could actually increase the survival times in glioblastoma, which it's pretty cool stuff when you look at it from that perspective about utilizing these adjunctively. What does that mean? Adjunctive means you have the main anti-cancer chemotherapeutic drug being used, but you're just not getting that anymore. Now these docs are adding in old drugs, sometimes a multitude of them, to treat the different facets of why that cancer may be spreading. Like one drug, stop the cancer from getting sugar. Another drug, reduce the inflammation. Another drug, stop histamine from causing the cancer to spread its nasty message out throughout the entire body. They call that metastasize to other organs. So all of these drugs are being used, and that's what, even atorvastatin. So how about you cholesterol guys taking Lipitor or Crestor, right? This is getting to be a relatively older drug. Why isn't it in use as much? And why do natural physicians tend to shy away from atorvastatin and these statin drugs? Because just about 5 years ago or so, it was shown that these statin drugs may risk the incidence of Alzheimer's and may risk incidence increasing of diabetes. So they're like, yeah, for natural physicians, we were like, I think there's better stuff than the statin drugs at reducing what they call coenzyme Q10, which is necessary for the muscle to get energy or to process energy. But it's shown that atorvastatin cancer patients who have higher levels of blood fats, they have more metastases and survive least, according to several studies. So what now they're seeing is that through current research, that people with cancer and have higher LDL, triglycerides, cholesterol levels are living shorter lives than those people with the same cancers that have lipid levels under control. So they figured, hey, if we can get the lipid level under control, then we're going to help the survivability of this person with cancer. So those are I have a couple more: aspirin, pyrimidol. So this drug is an old drug, Persantin, that we use to try. You had a question, Greg?
Yeah. What is the pronunciation of that drug?
Pyrimidol.
Pyrimidol?
Pyridamole. It was called Persantin, was a brand name of that.
Wow. Okay.
And if you had a stroke, maybe even a transischemic stroke, or you had a blood clot, perhaps, this drug was a fairly safe drug that was used to prevent blood clotting and prevent strokes. I remember, and it's dirt cheap. It's like a couple of bucks for 1,000 of them or something. I mean, it was a fairly inexpensive drug. It works a lot like aspirin. Aspirin stops something called platelets, which are blood cells. I call them my little sandbags, my platelets. They're part of the circulatory blood system, in which when you get a internal bleed or even a cut, how it stops the bleeding is when that cut occurs or when that bleeding occurs, our body releases a certain type of hormone locally into that area. And as that platelet, that usually is just like a bumper car, just bumping off of things and has not a sticky appearance or a quality to it at all of a sudden, when it comes in contact with that chemical that's released from an area that's bleeding, it all of a sudden changes that platelet to a platelet that now becomes sticky. And it's like a sandbag, and it just cements itself right to that area. And other platelets around in the area start building up a sandbag, almost like if you have a leak in a dike and water's coming out, you start putting a lot of sandbags around that to stop and plug the hole. You might have used bubble gum when you were younger to stop a leak in a container. That's kind of what dipyridamole or Persantin does. But now what we know is that cancer causes this, what we call it hypercoagulability. And what is that? It's a big fancy word for the body's making the blood thicker. It's easier for the blood to clot up or clump up. So that's not a good thing, right? So what would we think about that in our biomedical world? We would say, okay, if the blood's clotting, we don't want it to clot. We want to stop that. So let's give old drugs that were once used, like aspirin, has an anti-inflammatory characteristic, and it has a blood thinning, if you want to call it that, characteristic to stop these platelets from clumping up. And that's exactly what that drug does. It stops and interferes with that signaling, that chemical signaling, so that platelet doesn't become sticky and it doesn't want to clog up. Unfortunately, if you really are having an internal bleed and you're using these drugs that prevent blood clotting, that's not a really good idea either, right? That would be like if you had a stomach ulcer that was slowly bleeding, or the esophagus from irritation that was slowly bleeding, or you had a polyp in the intestine that's slowly bleeding, and you were to take these drugs without knowing that that other problem is going on. I just had that patient yesterday, came into the practice, and severe, what appears to be a severe autoimmune disorder that it looks like rheumatoid arthritis. And when I asked him about how are you treating it currently, he said, well, I'm using ibuprofen, which is a brand name of Motrin and many other drugs with that. But I was like, and looking at his labs, I dead stopped right in looking at his labs, because his hematocrit, his red blood cell count, and his hemoglobin were already low, significantly low. And I was like, did your doctor that ran these labs, did they say anything about an anemic condition with you? And he goes, no, not a word. I'm like, whoa, big miss. Because what happens is when you take these medications at higher doses like ibuprofen, they can induce stomach bleeding or intestinal bleeding in you. Now, it's not going to be rampant. You're not going to notice that. What you'll notice sometimes is that your stool is going to be a little bit more tarry. It'll be more black in color. It won't float like a healthy submarine. It literally sinks to the bottom if it doesn't crack the porcelain goddess. You have a difference in the stool. And if you're bleeding insidiously, which means little by little by little, you're not going to notice that your hematocrit and your hemoglobin, you're actually losing blood little by little. And when you come into me and you're having problems with swelling and inflammation, and it really looks like a pattern of autoimmunity in biomedicine, in Chinese medicine, of course, it's a circulation issue, right? So you would think, oh, give them herbs or give them drugs that will help the circulation. No, the only thing you're helping with that then is increasing the bleeding internally. So you got to be kind of careful that you rule out all aspects when you use these medications that the person is going to have a problem. Say you're using Inderal, which is another big one. It's what we call a beta blocker that a lot of people use for high blood pressure, arrhythmias, where the heart's not beating regularly. Thank you, Elaine, for watching on Facebook. Thanks, Cheryl, for watching on Facebook. Tracy, all you guys, thank you very much. But it's a variety studies. Numerous studies have shown that in a variety of cancers, such as breast cancer, ovarian cancer, colorectal cancer, small cell lung cancer, that these stress hormones are known to encourage metastasis. Means when the body is stressed, the cancer spreads faster. That's one of the things in natural medicine we all know, is that to inhibit cancer, the key is staying relaxed, doing mind-body meditation. Acupuncture is wonderful for that. Yoga, Tai Chi, Qigong, anything to kind of keep these stressor hormones under control. Because when they get out of control, the cancer spreads faster. But using this beta blocker, this propranolol, it's actually capable of reducing cancer's aggression and the metastasis, which is the metastasis, which is the spreading of the cancer. Isn't that kind of interesting? So you got to make the decision on your own. If you and your physician making this together, if using these repurposed old drugs is going to give you additional benefit over not using them because of the potential side effects. There's even antibiotics, doxycycline. This was an old drug. It's actually was used a lot in patients with acne, because the theory was that acne was a bacterial infection in the skin. And I wouldn't really say that it wasn't correct, because we do have a lot of staph on the skin, and when the skin pore closed and you had a bacterial infection, it would develop a cyst, almost like a boil. That's what they would call cystic acne. But now as a natural physician, I know it's all about, the majority is about diet, and it's about glycemic control. And I'm not going to get in that today, but doxycycline is a powerful antibiotic. You got to be careful because it has some nasty side effects to it, but it's shown to correct cancer stem cells and help normalize stem cells. What are stem cells? They're cells that really haven't been differentiated yet. There's cells from the bone marrow that say, hey, I'm going to go to school in the thymus if I'm an immune cell, and I'm going to learn all about the immune system before nursery releases me into the general circulation, and I can do my job in life, which is to help the immune system. A stem cell doesn't know what he wants to be in life yet. He's immature. And so, but the problem is if you hit cancer at the bone, you're going to hit stem cells. And a renegade stem cell is the worst critter on planet Earth, because not only does he not know what he wants to be, he can be anybody. And a cancerous cell can go in any direction whatsoever. He doesn't have to just go to the liver or go to the spleen, like pancreatic cancer or liver cancer or lung cancer. He can become anybody he wants to. Accutane, we already talked about that one. Accutane is nasty, but it's been used as an anti-cancer chemotherapy in the US. It's used for neoblastoma recurrence, and it's got some pretty good reviews when used with our conventional treatment. Methadone, oh my gosh, where have you heard about methadone before, right? The medication used to counter a lot of the opiate problems that we have in the United States for treatment of cancer. It's an opiate stimulator. It appears from research to help overcome drug resistance in cancer cells, and thus promotes a longer use of the drugs and greater survival time. Some evidence it can actually kill cancer in and of itself.
Now, isn't that what they use for heroin overdoses?
Yes, methadone.
Wow.
Methadone clinics, right?
Yeah,
Back in
yeah.
Bronx, New York, where my training was as a detox specialist. The National Acupuncture Detox Association, NADA, NADA, was created to try and, because we found that acupuncture treatment back in the 70s, it was 1972, Dr. Smith, an MD, and a Chinese doctor met. They kind of married. They wanted to the same pursuit of reduce the amount of individuals that were dying from drug abuse. In the Bronx, it was at I think it was called the Lincoln Clinic in Bronx, New York. And they started using auricular acupuncture from the ear, and just 5 simple points, all the detoxification points, the kidney, the liver, the lung, what we call a Shenmen, a calming point in the body, and a point to reduce the sympathetic nervous system, to reduce the stressor system in the body. And they started finding amazing improvement that people actually, when they came off of oh my gosh, heroin and cocaine, that they actually had increased resistance to going back on, which means the recidivism rate, how fast people go back on the drugs, was significantly reduced. And we found that for many years, even down in Miami, Janet Reno, when she was in office there, I think as the Attorney General, she actually instituted a drug rehab program that included NADA. And those patients had over an 80% reduction in recidivism rate versus a control model. Now you think to yourself, why aren't we still doing this, right? Why aren't we offering this in the entire country? That either A, hey, dude, you've been convicted of a drug problem. So you either have a choice. You can go to a drug center, which you're going to get more drugs, antidepressants, whatever, anti-anxiety agents to help you come off these drugs. Or you can literally go to a NADA physician and have acupuncture done. And with the stats showing it's so effective, I don't know. I think it's it's a money game and a control game for sure. But I'm all in if they decide, hey, from Dr. Shipe's show, why don't we think about that again? I'd be really happy that we have this integration again into our. I'm not saying that counseling and these centers that are popping up like crazy. I think at one time I heard there was 30,000 drug rehab centers opening in the United States every single week, or I'm sorry, every single month, I thought. But it was like crazy amount of centers. Why? Because during the Obama administration, they made this, drug addiction actually as a disease. And when he relabeled that at a federal level, insurance companies had to pay before, the insurance companies were resisting payment for drug abuse because they said it's not a disease. It's just a social problem. But that was restructured. And now, since the federal government said, okay, insurance, you got to pay for this, everybody and their brother jumped on that bandwagon and wanted to open up a rehab center. And I see it in my turf here, and not good stuff all the time coming out of that. But I'm not actively running one, so that's all I'm going to say on that one. Itraconazole, the last one I want to talk was, it's an antifungal drug. Itraconazole, I actually had a patient yesterday also email me, because my patients can email me, they can call me, direct response. Sometimes if you're looking for answers, you need a doc now. You don't want to wait. And I have a patient that I'm seeing, I think he's around 8 years old, 9 years old, has some pretty nasty behavioral issues, autism spectrum disorder. And we have been treating this young gentleman for maybe about a year, 8 months to a year. When I first seen him, his head was buried in his mom's chest, wouldn't even come out of his mom's chest to look at his surroundings or to answer me, relatively unresponsive, reclusive. And after about 8 months, all of a sudden he was responding. 10 months, he was back playing with his peers and his family, and all good stuff. And it was the result of a fungal infection, had high levels of some aspergillus. And if you, a functional physician, you understand what I'm talking about. You remove the true etiology of the neurological problem, which is a mold infestation, not infection, infestation. And you watch for colonization of pathogenic bacteria, and you remove that problem from the gut. People respond. They don't need drugs, but they asked me, hey, Dr. Shipe, what do you think about itraconazole treatment? Because instead of using like chlorophylline or chlorophyll or N-acetylcysteine, or this child has some genetic problems, you got to watch what we use as well. But I was like, yeah, why not a repurposed drug, right? That's exactly what we're talking about. Not for this child with cancer, but for this child with autism, this autism spectrum disorder. We just think this kid doesn't need antidepressants. He doesn't need Ritalin or these drugs. He needs to find the root. What's the root of the problem? Why all of a sudden his behavioral changed radically after they found, the kid came into the bedroom one night out of nowhere, screamed his bloody head off at 2 or 3 o'clock in the morning, freaked his parents out. And from that point forward, was diagnosed with autism spectrum disorder. Only to find, the parents are really in the know, only to find when they come to me, I was like, did you check for mold? They're like, our house was loaded with it. His bedroom was loaded behind the walls with mold. And that's where it probably was the etiology. That's where his problem started. So once you find out the root, then you're not relegated to have a child with autism for the rest of his life being given drugs that are just going to, if anything, are going to be just symptomatic treatment for the rest of this kid's life. So
what happens when you take the mold out of the equation then?
Oh, improvement, significant, but you got to be careful, because mold and bacteria, they can release endotoxins or mycotoxins, which when mold and bacteria are killed, they just don't give up the ghost and go away silently. Oh no, they leave with a vengeance. So when they die, they release into the blood system, into the local tissue, a bunch of toxins. Some of these are neurotoxins affecting the brain. Some of these are affect the gastric system. Sometimes they can even affect the muscle. So this patient can go through a massive detox. And detox to me is just the ability not to get toxins out of the body fast enough. They can build up in the blood. Patient can have nausea, severe headaches. And that's when people say, no, Dr. Shipe, I don't want to do your therapy anymore. And so you got to be very, very careful. Go slow and go low is a premise, even in pharmacy, and build up your dose so that the patient can constantly be clearing. You add things like you kill the mold, but then you have to get it out of the body. It doesn't like to leave. So you can use adsorbent materials. In natural medicine, we use things like bentonite clay or charcoal that will bind and hold to yeast, to mold, and pull it from the body. In Western medicine, they use drugs like Questran or cholamine resins. Can't remember the actual generic. I think it's cholestyramine, that's the word I'm looking for, cholestyramine resins, which are binding agents that they use for high cholesterol because it binds the fats in the gut and moves them out through the bowel, through the rectum. So here's another repurposed drug, right? Not for cancer. I really got off the goal with cancer, but so repurposed drugs for cancer in the UK, a lot of stuff, off-label use for a lot of few years that have really inspired the same at oncology centers throughout Europe. It just hasn't hit really big in the US yet. And I think the reason for it is because docs are on the fence, especially oncologists. We're like, I don't want you messing with my drugs because I don't know what's going to happen. You know, it's kind of like a cocktail, like a big cocktail. You start throwing stuff in, 1 drug, 2 drug, 3 drug. People ask me all the time, you know, is there an interaction between my medicines? I was like, question mark. I give you the best theories, but there's no literature, there's no research that says that when you add more than 1 drug and 1 drug together, there's a lot of good clinical research. Patients are taking 3, 4, 8 different drugs. Who knows? It's a medication cocktail at that point. And when you start throwing in chemotherapy agents and other drugs that may produce side effects or adverse reactions, we don't know. But the studies are showing that it's starting to produce some good results. So that's why a lot of these guys are all for it and kind of promoting this. Let's do this. Let's utilize these drugs because it's giving us a better outcome for cancer.
And by off-label, you mean generic drugs?
No, off-label means that the FDA, see, when a drug goes through its approval process, the FDA says, okay, you've shown us through clinical research that these people aren't going to die. You've given us all of the side effects and all the potential reactions. So we know how the drug potentially works, but you have to just do it for one thing, which means we're going to give you the blessing to bring this drug to market for only this indication. Like it's only for, like I mentioned, Elavil, it's only for an antidepressant to stop depression. But you can't, the FDA said you can't use this drug to treat migraine headache. But the doctor is he's got the last word on it. The drug company can't tell you what to use. FDA can't tell a doctor, an MD, what to use. It's the doctor's use of this data. He makes a decision, but he could be legally responsible for those decisions as well, because he's using a drug that the drug manufacturer and the FDA said is only supposed to be used for this indication and not for that indication like cancer. So if they use these drugs for cancer and something happens to the patient, could that physician be held liable? In my book, yes, they could be, because that drug is not being indicated for cancer. Now, if there's enough research and enough clinical studies behind using this drug in this manner, and a pharmaceutical company decides to pick it up by tweaking this or tweaking that of the drug and bring it to a patent level status again, then I would probably say yes. And I'd probably say that's going to start happening. Talk to me in about 2 years or 1 year. Let's make it only 1 year and see if all of a sudden we have a resurgence of what I call Me Too drugs, which means that why do we have Zantac? Why do we have Axid? Why do we have Nexium, Protonix? When Tagamet was working good, is because we wanted to have other people in the game to make money on drugs. So everybody and their brother jumps in. So I will probably estimate that what will happen is a lot of these pharmaceutical houses, once this clinical research is underway and it's really shown to be effective, now you're going to have another non-steroidal anti-inflammatory come out just for cancer. And it's as an indication so that they can make some dollars in making that drug again. I could be wrong, but I mean, I've been a pharmacist for 30 years and as a physician for 20. I've been in the game a long time and know kind of how it operates. And I would be really surprised if I was wrong on that one. Because right now they're not, in fact, right now, if they're smart, they would do that. If they're not, they would just continue to turn their head and say, we don't want anything to do with repurposed drugs for cancer. I haven't even gotten to the natural supplements that I wanted to talk about today and cancer. But if you would like to have more information personally, the way I suggest that is get into the office and talk to me one-on-one. You can do that many ways, but the fastest, easiest way is give me a call on the phone, 772-398-4550. Tell them you want to have a conference with Dr. Shipe. They'll give you a couple options for that to come into the office and sit down with me. 398-4550. You can look up our information on the web at traditionalchinesehealing.com, and you can type me an email message at info@traditionalchinesehealing.com. Other than that, you have questions about future shows, you want to have something more specifically answered, then call me or email me and I can get it to you that way. If you have other issues regarding cancer, folks, I don't want to mislead you that you shouldn't go to an oncologist or have chemotherapeutic care. That is absolutely not what this show was all about. But the show is about trying to find this integration, this beautiful combination of Chinese medicine, which we treat very, very effectively, reduce side effects of chemotherapy, can actually support patients' red blood cell counts, white blood cell counts, can help hold their appetite in place so that they can receive the Western treatment, which is designed to kill and designed really to eliminate, to eradicate the cancer. But along with that basic premise of do no harm, which we both, as Eastern physicians, Western physicians, take that oath. I think Western docs have a harder time with that one than traditional. So don't wait for the symptoms to come. In Chinese medicine, cancer is not about the treatment. Cancer is about the prevention. So to prevent the cancer, to keep the body functioning at optimum levels, so you never have to worry about the cancer. That's the goal of traditional Chinese medicine. So side effects, if they're already there, get it treated. They're going to get worse. You'll feel much better. Give the office a call, 398-4550, or on the web at traditionalchinesehealing.com. About out of time. Greg's given me the eye sign that I need to shut my mouth and move on to patient care the rest of the afternoon. I look forward to talking and hearing from you. May the dear Lord bless you folks until I see you again. Keep you in good health, especially from this virus, until we meet again. I'm Dr. Stuart Shipe on A Better Way to Health. We'll talk soon. Zai Jian.
You've been listening to A Better Way to Health with Dr. Stuart Shipe right here on WPSL, Port St. Lucie. Talk of the Treasure Coast, webcaster to the world.